Do you often feel that one of your legs is heavier than the other? Or maybe your sock leaves deep marks that stay visible for minutes. These might not just be tired legs. They could be early signs of a quiet but serious condition. Imagine wearing a tight glove every single day, but your arm swells slowly over years and no one notices. That's what happens in lymphedema tarda. This form of swelling usually starts after age 35 and affects the legs, especially the foot and lower leg. It's rare, yes, but real and life-changing if ignored. The worst part, many people think it's just getting older or standing too much. But it's not. Your body is sending you a message. Something's wrong with my fluid drainage system. Let's find out what's really going on. What causes lymphedema tarda? Think of your body like a city with roads and drainage pipes. The lymphatic system is the drainage system that carries away waste, bacteria, and extra fluid. In lymphedema tarda, these pipes are either missing, broken, or weak, but not because of infection or surgery. Instead, it's something you're born with, even if it shows up later in life. It's like having a dishwasher with a weak pump. It works fine for years, but one day, water starts pooling. The exact cause isn't always clear, but doctors believe genes play a big role. If your parent had swelling in their legs with no clear reason, you might be at higher risk. It's not caught by a virus, and you can't catch it from others. It's just your unique body system, finally struggling to keep up. How do you know if you have it? Let's play detective. Press your finger on the top of your foot for 5 seconds. Does it stay indented-like when you press a pillow? That's called pitting edema, a classic clue. The swelling usually starts in one foot or ankle and moves upward slowly. It's painless at first, so many ignore it. But over time, the skin gets thick, hard, and maybe even warty. Shoes feel tighter, even if you haven't gained weight. You might feel heaviness, aching, or limited movement. One real-life clue. Someone says, "Why are you wearing socks with marks that don't go away?" Or you notice your leg looks tree-like with rough skin. These aren't signs of aging. They're red flags your lymph system is failing. How do doctors find it? They won't just look at your leg and guess. First, they rule out heart, kidney, or vein problems, because those can cause swelling too. Then, they'll likely suggest a test called lymphoscintigraphy. Imagine drinking a safe, tiny amount of dye that glows in your lymph vessels. A special camera tracks how it moves or doesn't move. Slow or blocked flow means lymphedema. There's no cure, but treatment helps you live well. The key is daily care, wearing strong compression socks or bandages, doing gentle leg exercises, and keeping skin clean and moisturized. A therapist might teach you manual lymph drainage, a special massage to push fluid out. Think of it like unclogging a slow drain every single day. Start late, then treatment gets harder. Early action is power. Can you stop it before it starts? If you're at risk, like having a family history or a slightly puffy ankle, yes, you can fight back. First, never ignore swelling. Second, take care of your skin. A tiny cut on a high-risk leg can turn into a major infection because fluid buildup traps bacteria. Use lotion daily to avoid cracks. No tight clothes or crossing legs for long. Keep active. Walking helps the muscles pump fluid upward. Always wear compression socks if advised. Avoid hot baths, saunas, or standing too long. And never get blood draws or blood pressure checks on the swollen arm or leg. That can make it worse. Small steps, big protection. Think of it like brushing your teeth. Daily care prevents bigger problems later. What's new? Science is finally catching up. In the past, lymphatic diseases were ignored. Now, researchers are using advanced imaging to see lymph vessels in amazing detail. Some are testing drugs that may help grow new lymph vessels. Imagine healing from inside. Gene studies are looking for the exact mutations behind lymphedema tarda, which might lead to early testing. Also, smart compression garments with sensors are being developed. They'll buzz you if swelling increases, like a fitness tracker for your lymph. One day, treatment may go beyond managing symptoms to actually repairing the system. That future isn't here yet, but it's on its way, thanks to patients speaking up and scientists listening.